Laminitis is the inflammation of a network of blood vessels, known as the laminae, within the hoof, a very painful and often fatal condition.
Inside the horse's hoof, attaching the bone to the external hoof wall, are some structures called lamina. And it is the breakdown within these lamina which cause the bone to separate from the external hoof wall. This is a CT scan of a horse's foot, the normal veins of a normal horse's foot. You can see that the veins cover the entire surface of the coffin bone and in the bottom of the foot as well. This is a CT scan of a horse with severe laminitis. You can see the massive amount of destruction of the veins in this horse's foot. The whole front part of the sole, they're gone, and the front of the foot. And this is from the pressure of the bone moving inside of the foot.
What is it about this condition that affects the horse's feet that makes it so painful?
The whole skeleton of the horse, with its large weight up to 600-700 kilos, comes down into the pedal bone, and the pedal bone is suspended inside the hoof, like that's inside there. And if the laminae, which glue the pedal bone to the hoof, the sensitive laminae on the pedal bone attached to the horn of the dead horn of the hoof, they're interlocked, and in laminitis that becomes inflamed, and then they can become detached from each other.
And what are the obvious signs that a horse or pony is suffering from laminitis when you look at the horse or pony?
So the signs really are of foot pain, and foot pain in the front of the foot. So the pony will stand with its legs forward to try and alleviate weight bearing from the front of the foot and take it onto its heels. They bring their back legs underneath the horse to try and again take the weight off the front feet. Most laminitis is front footed. They can get it in the back legs, they can get it in just one leg, but most commonly that stance is the one. And determining early laminitis or low grade laminitis can be quite difficult to determine from other types of lameness. In the field situation, one of the more common things is that pony hasn't moved from that spot for a day or two, and perhaps because it can't. Lying down a lot is quite a common one as well.
The exact causes of laminitis are unclear, but there are a number of different factors that have been known to induce laminitis in horses, such as high intake of carbohydrates, stress, severe infection, obesity, concussion, and Cushing's disease.
We know that certain conditions, such as ingesting large amounts of grass in the spring and the fall, can predispose a horse to also get laminitis. And then we know that horses that are obese or overweight have much more of a tendency to develop the disease.
High intake of soluble carbohydrates. This type of laminitis usually happens with the spring flush of grass. When too much sugar and starch is ingested, either through pasture or grain, it causes an overload in the digestive system, and undigested sugar and starch is pushed through the hindgut. Bacteria in the hindgut begin to break down the undigested material, causing acidity, which kills the good bacteria in charge of digesting fiber. As the bacteria die, they release toxins, which are then passed into the bloodstream through the gut wall. These toxins provoke a response which disrupts blood flow, which, in the feet, can cause laminitis. Obesity. Many horse owners are guilty of overfeeding their horse. In the UK, horses have access to rich, high-sugar pastures, as well as being fed energy-dense, high-sugar and high-starch feeds. Horses never evolved to digest such feeds, and their metabolisms struggle with high amounts of it. In addition, when a horse is eating more than he needs to cover his requirements for maintenance and work, it will quickly gain weight. Obesity in horses is more dangerous than anorexia. Excess weight puts strain on the horse's vital organ as well as its limbs and predisposes the horse to laminitis. Whether the horse has already had a laminitis attack or not, treatment and prevention measures are similar and include reducing sugar and starch to a minimum in case an insulin response is involved, re-establishing the correct bacterial population in the gut, and reducing pain. Stop feeding grain, which is high non-structural carbohydrates and starch levels. Restrict access to pasture, which has high levels of non-structural carbohydrates. Only feed forage low in non-structural carbohydrates. Feed only for body weight. Feed about 1.2 to 2% of body weight, no more. Establish body weight, if possible with a weighbridge, and condition via the method of body condition scoring. Keep the horse in work where possible. Administer non-steroidal anti-inflammatory drugs for pain management. Use remedial shoeing or barefoot trimming. Place the horse on a soft, cushiony surface. Once the horse is sound, offer the horse an altogether more natural lifestyle, perhaps considering paddock paradise, which encourages natural feeding, movement, and social interacting and promotes good health.
Prevent it. Because the disease does so much damage to the horse's foot, they can never be the same.